You check your daily medication bottle on the bathroom counter, and you suddenly realize your supply is running low. You are on a 60 or 90-day care plan, yet right there on the label, the bottle explicitly states you have 0 refills remaining. This discrepancy occurs because of how specific medications are regulated, creating an administrative hurdle between your doctor's office and the pharmacy counter. We are going to walk through the exact steps you need to follow to secure your next 30-day supply without missing a dose. To start, you will need your current pill bottle and your pharmacy's mobile app. Managing this bureaucratic process is a necessary part of your care routine, ensuring your treatment continues as intended. First, look at your bottle and identify both the generic or brand name and the dosage so you know exactly which medication you are managing. Federal and state regulations often require controlled substances to be issued as a standalone prescription for every 30-day supply. This means that during your appointment, your provider actually writes 3 distinct, separate 30-day prescriptions to cover a 90-day plan. Your first month is filled immediately, while the prescriptions for the second and third months are sent to your pharmacy to wait on file. Pharmacies are typically restricted from automatically filling these subsequent scripts, which means you must be the one to initiate the process. When you see no refills on a label, it indicates that the legal requirement to activate the next 30-day script now rests with you. A common mistake is waiting until you take your last pill before you reach out to the pharmacy. You can avoid a gap in care by using a buffer period, taking action a few days before your current supply runs out to account for any processing delays. To see how this works in practice, we can look at a standard 30-day medication cycle. Days 26, 27, and 28 are your action zone. This is the window where you should contact the pharmacy to request your next supply. During this window, call the pharmacy directly. Once you make that request, the pharmacist locates the standalone prescription your doctor sent previously and begins the dispensing process. Using the action zone gives the pharmacy the time they need to handle the legal paperwork without interrupting your daily schedule. Even with perfect timing, you may encounter an issue where the pharmacy cannot immediately activate the request. This flowchart illustrates the 3 most frequent bottlenecks and how to resolve them. If the pharmacy says the prescription is not on file, contact your provider's office. Ask them to verify the prescription was sent, or to resend it if there was a transmission error. If the medication is out of stock, ask the pharmacist about alternative doses they do have. Then contact your provider to adjust the prescription to match the pharmacy's current inventory. If a price change makes the medication unaffordable, talk to your provider about alternative drugs or programs that assist with medication costs. These challenges are administrative in nature and can be managed through clear communication. A concrete troubleshooting protocol resolves these issues through a series of routine phone calls, preventing a temporary delay from becoming a crisis. Once you have picked up the new bottle and returned home, the final step is ensuring you take the medication as prescribed. Immediately unpack the bottle and sort your pills into a labeled daily organizer to keep your physical routine consistent. Update your digital systems by setting daily smartphone alarms and ensuring your master list of all medications and supplements is current. Navigating the pharmacy bureaucracy is only effective if your daily habits allow the medication to work as intended. You now have the tools to manage standalone prescriptions and maintain continuous access to your care. Proactive communication and organized timing are the most effective ways to ensure your health and well-being remain uninterrupted.